Alaikum. So the topic of today's video is carcinoid tumors. Carcinoid tumors arise from neuroendocrine cells and they most commonly arise in the intestine or lungs. Neuroendocrine cells secrete serotonin. This serotonin undergo hepatic first pass metabolism in the liver. If serotonin reaches the systemic circulation, for example, if the liver is diseased, for example, in the case of liver metastasis, liver dysfunction is there and there is decreased metabolism of the hormone, so there is build up of this hormone in the systemic circulation, and that is going to cause the or it is going to present as a carcinoid syndrome. Carcinoid syndrome symptoms get worse by alcohol and by the emotional stress. In carcinoid syndrome, there is increased histamine and bradykinin that is going to present as vasodilation that can cause the flushing and itching. Whereas increased serotonin is going to cause the thickening of the collagen that can cause fibrosis and that can result in dysfunction of the heart, tricuspid regurgitation, and pulmonary stenosis. Moreover, this fibrosis can also cause the bronchoconstriction that can lead to wheezing, asthma, and shortness of breath. In abdomen, it can cause the retroperitoneal. It can cause the fibrosis of the retroperitoneal organs or mesenteries, and that can cause urethral obstruction, and it can also impair the kidney functions. It also causes a decrease in tryptophan level, and that is going to result in decrease niacin, and that can cause pellagra. Its diagnosis can be done by the urine analysis with increased 5-hydroxyindole acetic acid. Histological features are prominent rosacea, which is not a characteristic pattern of carcinoid tumors. It can present with other pattern as well. Chromatogranin A is positive and synaptophysin plus is also positive. The treatment of carcinoid tumor is surgical resection, somatostatin analogs, for example, octreotide, or tryptophan hydroxylase inhibitors, for example, telotristat, which is used for the symptom control. Rule of third can be used to remember the characteristics of carcinoid tumors. One-third of the tumor metastasize, one-third present with second malignancy, and one-third are multiple. This was all about carcinoid tumor. Thank you for listening.